Good morning, ladies and gentlemen, dear colleague, dear chairman. We start the field of bariatric, metabolic surgery and treatment now. And one of a very interesting topic will be that a lot of obese women cannot get pregnant. So basically the disclosure shows that I don't have any conflict of interest with my relationship to corporate and industrial world related to this presentation. We know that women who had bariatric surgery and got pregnant, they have a lower risk of gestational diabetes mellitus and fetal macrosomia as compared with non-operated, non-treated obese women. We have very interesting publications in literature about pregnancy, bariatric surgery, and one of a highlight, I would say, that is really interesting to discuss is that there's no evidence to support the recommendation that we should delay pregnancy after bariatric surgery. This is really a very awesome paper, which is a matter we could discuss. Nevertheless, I will not bore you with hundreds of papers. I would like to summarize that after bariatric surgery, we have improved female sexual function. There's a lower risk of gestational diabetes mellitus. We don't have any evidence that bariatric surgery will affect congenital malformations of the babies. And the last I already mentioned regarding the delay of pregnancy after surgery. Nevertheless, we opened a lot of questions where we started a prospective study in patients who had bariatric surgery, banding and bypass ladies. So a few questions we want to, let's say, highlight. And we have one hypothesis that we wanted to investigate, and that's that bypass patients have less weight regain after surgery than band patients. That was one interesting question we had. The second hypothesis was that patients with a band enlargement or band deflation, they do have a higher weight gain compared to non-adjusted band patients. And of course, one of a very important topic is supplementation and nutritional status after pregnancy. And the knowledge of pregnancy should increase the compliance. So that is a hypothesis number 3, and those we want to share with you. So that was a prospective study based on a quantitative questionnaire, all done with recommended statistical analysis. We did this before surgery, during and after, before pregnancy, during and after delivery. So we found from 380 pregnant women, 120 who were voluntarily willing to participate in the study. To analyze patients who got pregnant, we see that the vast majority of ladies had the surgery 18 months ago. But nevertheless, 8% of our ladies had pregnancy within the first year after surgery. Mean age 32, and the range was from 21 to 44. So in summary, we can see that patients who decided or had a gastric bypass surgery had an initial higher weight, but they lost significantly more weight compared to the band patients. That was the lowest weight before pregnancy. And if you see the weight gain during pregnancy, it's parallel. So the weight gain is pretty similar in between band patients and bypass patients. Non-surprisingly, the weight loss for bypass patients was significantly higher. That's not a surprise. But even at the end of the day, so the actual weight long after, and the long means 3 years after, that's the mean follow-up, is significantly higher at the end of the day for bypass patients compared to band patients. But nevertheless, the weight gain, the percentage of weight gain is pretty the same. The weight after delivery is significantly higher for those patients who never had a band adjustment during pregnancy or a deflation of the band. And even at the end of the day, the lowest weight after pregnancy for those patients who had a perfect adjusted band was significantly higher for those who had, during pregnancy, a band deflation. So the conclusion from that study is that there's no need to deflate the band except a patient need that. The babies, fortunately, all of them were in a wonderful situation. We don't have any gestational malformations in our 300 and even 380 babies group, so to say. The weight of the babies, there was no significant difference in between the bypass babies, let's say the bypass mother babies, and the band mother babies. So 90%, exactly 91.7% of all babies had a normal weight. But what is really amazing is about the compliance of nutrition, nutritional status, and supplementation. We all know that it is an absolutely demanding that if you have a gastric bypass surgery that you need supplements, you need protein, etc., etc. But 41 of our female patients who had a pregnancy didn't take the supplements as recommended. Before pregnancy, during pregnancy, and only during pregnancy, yes, ladies took them, but even only in a very low percentage. So the message for that is that we have much more to focus on supplementation and post-operative, peri-operative, multidisciplinary approach, especially in those patients, especially in those women who want and get pregnant. So just to summarize, I would say to take a home message, the weight gain in between band and bypass patients is not significant difference. At the end of the day, the weight loss itself, of course, is highly significant difference and in favor for gastric bypass patients. Patients with a band deflation have no higher weight gain percentage-wise, but at the end of the day, the lowest weight is, of course, higher for those patients who never had a band adjustment during pregnancy. So once the band is perfect adjusted, we would say don't fiddle around and don't deflate, otherwise it is necessary. That's different. And one of the most dramatic information we got, those informations that the patients are not compliant as we wished. So the supplementation as recommended for bypass patients is really a demanding topic. And this message, I think, we should really burn and take under our nails. So what is obesity concern for children and adolescents? Obese parents do have obese children. And we would say a treatment delayed, maybe treatment denied, a crisis invited. That's the statement from Inge, very famous Swedish bariatric surgeon. So nevertheless, I would love to invite you to Vienna, to the World Congress, which I have the privilege to run this meeting as a conference president. The flyers should be handed out, should be around, and I would be pleased if you send over all your abstracts, all your interest presentations. And I thank you very much for your attention and would be pleased to discuss with you that topic. Thank you.
for this very interesting presentation. Are there any questions? Please.
Very nice presentation, Professor Miller. I'd like to ask, like 41% of your women did not follow the nutrition. Did it have any ill effect on the babies born?
Interesting not. As we have seen that 91% of the weight of the babies were normal. They had over 3 kilograms. So that we couldn't see any deficiency in the babies reported. Nevertheless, we didn't really focus on, let's say, the bone density, the protein habit of the body of the mothers. So this is an information we'll say that study should bring out more ideas about doing investigations in what's about the mother. The mother delivers the baby whatever the baby needs. That's the message. But we didn't focus so far what's with the mother, what's with the protein consistent, what's with the bone density, what's with the mother. This is something that we should focus on, and that we also take more attention on supplementation for those patients.
Another small question. Is the take-home message is that it doesn't matter, women can get pregnant any time after bariatric surgery?
There is no consensus so far. There's only a recommendation from pediatrician, from gynecologists, that we should avoid pregnancy in the first year after bypass. That's a recommendation. But there's only one paper that really shows that doesn't matter. But it is not a prospective, it's not a randomized, it's not fulfilling all our scientific criteria. But the report of that paper, of that US group, showed that it doesn't matter at what time the mothers are getting pregnant. But logically, in the first year of a bypass, you lose, let's say, 60 up to 70% of your overweight. That means your body is in a catabolic situation. And from my, let's say, understanding, it's not the perfect idea to get pregnant when you are in a catabolic situation where you lose weight, where you burn all your energy. That's just an idea, but it's not really scientifically proven so far.
2 questions. First question is, of course, a patient that is that heavy many times has disturbed cycles, has no ovulation, cannot conceive. So many of them that I've observed, they only have regular cycles developing after the surgery. That takes already a year. As you said, after 3 years, it's easiest. So one question is, what influence do you think it has on the development of normal cycles? And second question is, as gynecologists, we normally advise patients to lose weight right after pregnancy because that is mostly metabolically the best time that they can lose weight. Is this also indicative for the patients after bypass surgery?
Absolutely. This will work. What we see is that patients, even when they delivered babies after delivery, after pregnancy, the bypass patients, they do have highly significant lower weight compared to non-invasive procedures, non-that invasive procedures like bandings. The problem is that all women gain weight. The question was, who will gain more weight? Those who have an open band, those who have a band compared to a bypass. So even bypass patients gain weight, but the curve of weight gain is parallel, is very similar, regardless
so
which...
It's the same if they have had bypass surgery or if they have been slender in the beginning. So it's the same weight gain during pregnancy.
Absolutely, it's really parallel. The only thing is the absolute weight loss is highly in favor for bypass patients.
So the Haline study proved that, I think I read that once, also the patients, there were more than 50% of anovulatory cycles after their operation. They only could conceive. They could not even have conceived before. That was also one finding.
Most probably, yes.
Yeah.
I think another question is this, ignorance to take supplements typical for our home country, Austria, or is this observed also in other countries?
Thank you for that question. It's worldwide phenomenon, and sorry to say, and it's especially also in Middle East. So this is a topic where you guys should really focus on. I was 1 week in Kuwait just to speak and to talk with patients. None of them had any idea what's about nutrition, what's about supplementation after a sleeve or bypass surgery. So that was really amazing to see. It's a worldwide phenomenon, and wherever you work, this is because a patient has an expectation. I want to lose weight. All the other rest, I'm not interested. And it's in our brain to bring over this multidisciplinary philosophy in the patient. That's the first to change your lifestyle before you start surgery. So that's my comment to that question so far.
Thank you very much. Is there another question? If not, thank you very much.
Thank you very much.
Thank you.